Hi, everyone, and welcome to LA Family Housing's first live town hall. I'm Stephanie Klasky-Gamer, President and CEO of LA Family Housing, and I'm looking forward to sharing updates and answering questions from you today as you see what our team's been up to the past 2.5 months under COVID-19. As many of you already know, LA Family Housing is one of the county's largest homeless service providers and real estate development companies, serving more than 11,000 people each year. Our work with families and individuals has been essential these past few months. And in many ways, I think that we, as a county and at LA Family Housing, have been preparing for this moment, this pandemic, over the course of the past few years. LA County's homeless delivery system, in partnership with the city and the state, was able to respond immediately and effectively during this pandemic. Today, you'll hear from members of our team and see how our work has changed to literally save lives every day. Staff will come to you live from our Taper Bridge Housing, our outreach team, one of our new Project Room Key hotels, and finally, from the construction site of one of our 4 new residential properties we've been building during this crazy time. As we all stay safer at home, thank you for supporting LA Family Housing to ensure that those without a home are safe as well. Now I want to turn our town hall over to Katie Tell, our Chief Development Officer, who has done an amazing job with her team raising critical funds these past few months to keep our work going. Katie?
Thanks so much, Stephanie. Hi, everyone. I'm so happy to be here to connect with you, our supporters, our volunteers, all of our partners. We're having this call to connect with you all directly and really give you an inside view from our key program leaders of how we've ramped up in response to the COVID-19 crisis, essentially what our new normal is on the front line. So we're going to share a little bit about the format today. As Stephanie said, we'll be hearing from 6 of our key staff who represent some key strategies of our work together. So that's shelter or bridge housing, street outreach, housing navigation or housing placement services, and our real estate development work. Our staff will each take a few minutes to talk to you about their frontline new normal, and we'll save about 15 minutes at the end of the call, at the end of our hour, for your questions. So please enter those questions as we move along in the Q&A box on Zoom. So I think the perfect place to start is on site at our Taper Bridge Housing, Kelsey Madigan, who's our Director of Interim Housing. Here at LA Family Housing, we operate several interim housing sites for families and adults, and that provides a safe temporary home for people experiencing homelessness while they connect to resources and services aimed at helping them find permanent housing. So Kelsey, she manages our S-Mark Taper Bridge housing site for 250 single adults in North Hollywood. Kelsey, hi. What has been the initial response to COVID-19 at the Taper? How would you describe your new normal for all of the program participants and staff at our bridge housing?
Hi, Katie. Thank you. Sorry, y'all. It's a little bit loud at our Taper Bridge housing site, but I'm here in our lobby. So one of the first things that we did to make sure that we are social distancing was put these little markers on our floors in our cafeteria to make sure our participants are staying 6 feet apart. We also created additional dining halls as well to make sure participants are not eating more than 10 people at a specific location. Also, we have implemented these. Hi, Shrika. She's our interim housing manager. We also implemented these plexiglass screens to make sure our staff are also remaining safe while interfacing directly with our participants. So now we are headed to our Serenity area where we still have our mental health specialists doing connections to Department of Mental Health and additional therapy services for our participants all throughout the pandemic as our participants adjust to what is our new normal. So this is our Serenity area, and also behind me we'll walk into our Zen garden. So other than creating additional meal times and additional places to eat, we have been providing continuous education to our participants. We provided PPE to all of our staff and our participants, including face masks, gloves, and hand sanitizing stations. And we also moved several participants to our Project Room Key sites that are all across the county and specifically in Spa 2 as well. So as we move on, and the county opens in some respects, we are still utilizing prevention strategies recommended by Department of Public Health and Department of Health Services that have helped us flatten the curve through this time. We've learned a lot of new strategies related to health and wellness that will be essential in maintaining health and well-being of our participants even past this pandemic. Thanks, Katie.
Thank you so much, Kelsey. It's great to see you from the taper. And as both Stephanie and Kelsey mentioned, LA Family Housing, we're really proud to have pivoted quickly and partnered with the county in the statewide Project Room Key effort. Most of you probably know Project Room Key. It's a collaboration by the state, the county, and the Los Angeles Homeless Services Authority, or LAHSA, to secure really critical motel and hotel rooms for vulnerable people experiencing homelessness. And so I'm really happy to introduce you to Quentin Carter, one of our housing navigators, who's going to give us a closer look at what's happening at one of our Project Room Key sites in Reseda. Hey, Quentin, how are you?
I'm fine. Thanks, Katie. I'm really proud to be part of a team that was so quickly able to pivot during COVID. We were able to create 4 shelters within the past month. I'm at here one now in Reseda, which house 101 residents, and we have 74 units. And all of the residents here are pretty much older with underlying health conditions. And that's part of the county's Project Room Key. Right here, we have our nurses station, constantly monitoring all of our residents as I go out. All right, the residents at Project Room Key are coming from all over, from encampments on the streets to overcrowded shelters and different outside engagements to basically lower the density at those sites. As far as day-to-day, each day is different, but always starts with a team huddle. We get everyone on the same page, and that's information from the nurses, other colleagues. We monitor everyone closely, testing temps regularly, and providing everyone with meals and support. Personally, I am all of the teamwork. We're all completely focused and making the goal remains the same. Thanks, Katie.
Thank you, Quentin. Sorry, folks, for a little bit of a technical glitchiness there, but literally we are on the front line reporting to you today. And, you know, sometimes Wi-Fi, as we all know, can be a little bit unpredictable. But thank you, Quentin, so much. It's really incredible to think that as an organization, we've taken on 4 new shelter or interim housing sites, essentially, through these Project Room Key sites. So that's 450 new participants of our programs that we've brought in off the streets. So that's a lot of growth and a lot of sort of ramping up in response to this crisis in a very short time. Now I'm really happy, we're gonna hear from Melissa Rosen, our Director of Engagement, about our outreach efforts. So outreach in encampments or on the streets, for us, that's often the first point of contact that we have with people experiencing homelessness. Last year, we had over 4,000 different touch points or interactions with participants in the field. So whether it's building trust, handing out goods, supplies, and connecting people to resources so that they can find and access permanent housing. So Alyssa, can you talk a bit about your team and what it's been like on the front line during the COVID pandemic, and sort of how does your work look different during this time?
Hi, thanks, Katie. I'm over here at the Irmis Family Campus right now. And since we went into COVID response strategies, our outreach teams have been out in the streets 7 days per week, still supporting our most vulnerable neighbors out there. We're still hitting the Sepulveda Basin, riverbeds, parks, encampment near freeways, the streets, and in the desert over in the Lancaster-Palmdale area. Our outreach has shifted to education, prevention, and wellness, and we are supporting many individuals to the COVID response interim housing sites that include Project Room Key, parks and rec sites, and the quarantine isolation sites. We are now also leading testing efforts in our service area in the Valley for Spa 2 that also includes Santa Clarita and adjacent neighborhoods. And this is being supported by Department of Health Services. I'm happy to report that in the last 3 weeks, we have done over 300 tests on the streets. Department of Health Services is also providing additional PPE of face shields, gowns, and respiratory masks for our medical providers and masks for our clients. So there's been really great collaboration with our departments, with other departments, including Department of Health Services, LASA Outreach, LAPD, Department of Mental Health, and Department of Public Health, along with Los Angeles Fire Department, helping with some pop-up testing sites. We've also been working with the County Disaster Service Workers Program. We've had some amazing support from other agencies within the county to support our outreach efforts and testing strategy. And I'm happy to announce that we are going to start leading efforts in Service Planning Area 1, the Lancaster-Palmdale area, for testing, to further do testing strategies out there. And we plan on continuing to support the most vulnerable into safe interim housing options, wellness checks, and street testing, and of course, still working on permanent housing solutions. Thanks, Katie.
Thank you so much, Alyssa. And it's just incredible to hear your team has always been on the front line addressing the homelessness crisis, and now essentially your work is addressing the COVID-19 crisis within the homelessness crisis. So just so appreciative of all the really hard work that your staff are doing. Now we're going to hear about our housing navigation program. So navigation and the team that supports that work, they're essentially helping our program participants develop a housing plan, helping them address barriers to housing, and reminding you that the end goal of all of our work is keeping people moving into that permanent housing. So even in the midst of the COVID-19 crisis, we have not lost our focus on moving people home. So I'm really happy to introduce you to Dan Parzial. He's our Senior Director of Housing Navigation. And Dan, talk a little bit about how is housing navigation work changing in the face of COVID-19, and how's it all going?
Hi, everyone. Thanks, Katie. I'm here at the Canby House. It's an interim housing site for our families. And housing navigators really rely on a lot of face-to-face interaction with both our families and our single adults to help people think about what that path back to permanent housing might look like. So it's been a major challenge moving that work to remote operations where we're trying to get in touch with people over the phone. But in spite of all that,
I'm really sad to say I feel like we've lost Dan. Dan, if you come back, shoot me a text. I'm really sorry that we lost you there. But Dan was, and I'm really sorry he's not there, he's going to talk about housing navigation and how even in the midst of this crisis, I think we're moving over 40 people into permanent housing per month, and his navigators and their teams, normally they're meeting in person, face-to-face with our participants, sitting closely in rooms and at conference tables. So now, as you can imagine, they're still doing this work, and they're pivoting and innovating and doing it on Zoom, much like how we're talking today, FaceTime, phone calls. So still making those important connections, still addressing barriers to permanent housing, and still moving people home. So Dan, I'm sorry we lost you there, but maybe we can get you back in later for the Q&A. So now I'm going to introduce someone, Dan Nguyen, to talk about our real estate work. And what makes LA Family Housing really unique and stand alone in the space that we're operating in is that we're both a homeless service provider and also a real estate developer. So that means we are moving thousands, 11,000 people home every year while also building permanent homes. And as we know, you end homelessness with a home. And even in the midst of COVID-19, we are still building permanent homes. We own and operate about 27 properties of affordable, supportive, and interim housing. And I think we have about 13 more in our real estate pipeline. So those will be coming online in the next 5 years. So I'm happy to introduce Daniel Nguyen, our VP of Real Estate. And I think he's live calling in from one of our construction sites right now. Hey, Daniel.
Hey there. I hope all of you are doing extremely well. I just want to show you one of our construction sites that will be done by July. And so let's walk you through it. Of course, safety is paramount here. What I want to do is I want to share with you a little bit of the hillside. Isn't that amazing? The Royal is a temporary bridge housing site housing 85 women temporarily. We have 85 beds. So let me just walk you through. So as you can see, we've had applied on the prime coat. Our team, of course, gets a chance to transform these buildings into really beautiful, beautiful buildings. So this is one of our paint selection. We have option 1 and option 2. Maybe in the chat function, you can tell us which option works you prefer. So again, option 1 and option 2. All right, folks, let me just continue walking you through and show you the inside of the Arroyo. So as I walk through, this is, of course, we use trauma-informed care design. And one of the biggest things that we talk about is how do we make sure that we're designing lobbies and spaces that are allowing folks to heal and to essentially be able to get great service delivery. So again, this is a lobby. We have water fountains here. I'm gonna be walking you through, this is where the case management work is going to happen. One of the things I talk a lot about is how do we help to make sure that while my team and I help to build these spaces, how do we help to make sure that our program staff are able to act as magicians in terms of helping to ensure that we're able to provide great services. So let me continue walking you through the space. We're in construction. Again, our hope is to get this all done by July. So these are private meeting spaces in which our staff will be working with the program participants. As you can see, some of the drywall has already been hung. We have to tape and mud it. Here's some of the insulation. Okay, and this is some of the air conditioning equipment that's waiting to be installed. This is one of the hallways. And this is one of the dormitories. As you can see, some of the lights have been installed. We've applied a prime coat on the ceiling. So one of the more important things to know is that, okay, here we go. Surely we're building a momentum for our work, and equally important, we're building a movement and changing the way we build. So thank you for this opportunity and sharing a little bit more about the Arroyo. I'm gonna hand this over to Katie.
Hi, Dan. Okay, thank you so much, Daniel. So it's so exciting to see you live with your hard hat on at the Arroyo. I'm really excited, and we initially had been planning a very exciting grand opening event at the Arroyo to really welcome these 85 women into their new interim home. We are, pivot's the word of the day, so we're trying to come up with a really interactive and exciting way to open this space. And so stay tuned on that, and we hope you can join us in whatever virtual way that is. So now we're going to turn to our Q&A. We've had a lot of good questions coming in. So I'm going to read out some of these questions for Stephanie to answer. And if we don't get to all of your questions, we will be sending a summary of our responses and sort of an FAQ to everyone that registered for this event, so we can do our best to address some of your questions. So Stephanie, one of the first questions that we got was, could you please talk through your process for resolving encampments? If there's an encampment near me, can we just reach out to you to help resolve that, and talk through, how your team addresses and approaches encampments?
That's a great question. Thank you so much for asking. The encampments have really been a key focus area of ours during COVID, recognizing that people who are living in such close quarters together might be healthier and safer if they're able to move indoors. And we've dedicated one of our Project Room Key hotels, a 240-room hotel, to really focus on those most vulnerable with underlying health conditions still living outdoors, and we've brought those encampments inside. I believe if you go on our website, you can see a video on the Bradley Paxton encampment. That was an encampment of about 50 individuals living in the Pacoima area the last 4.5–5 years that we've been working with for about a year and a half. And we were able to move that entire encampment into one of the Project Room Key hotels so everyone could stay healthier and safer. In terms of encampments in your neighborhood, you can still use the LA HOP line, or of course you can write to us at LA Family Housing and let us know. We can only move people from an encampment if there's some place to move them to. So if there isn't a place to move them indoors, as we were able to do with Bradley Paxton, what we are doing is increasing our outreach, making sure people, as Alyssa shared, are educated and tooled with the resources they need to protect themselves from the spread of COVID, whether that's the PPE, or it's the washing stations and toilets that are out by that encampment. So that's how we're really working with participants still living outside. Katie?
Thanks, Stephanie. So a few different questions about Project Room Key, which makes a lot of sense. This is a new initiative, so I want to try to summarize this. One of our viewers has expressed that there's been some confusion about the status of the program, issues, some media coverage, comments from electeds and others. You know, have there been challenges in securing more motel rooms, as well as are there challenges, you know, filling those rooms, unoccupied rooms? Can you talk about kind of some of the projections for this program?
Sure, of course. And it's understandable. It has been somewhat confusing. Whenever you do anything so bold and so quickly, you're working out some of the kinks along the way. So as many people know, the state set a goal of 15,000 hotel and motel rooms across California. We had a similar goal just here in LA County, but if we're just working along with the state goal, that goal has actually been met. And we all read in the paper last week that there's been some challenges in filling all of those rooms. In LA County, we've done a fantastic job of filling all of the Project Room Key hotels here. We've had, particularly with the city of LA, has been a phenomenal partner in supporting these hotels and motels that are in the city boundaries. And then we also have some hotels in other parts of the county. And we've done a great job in filling up all of those rooms. But I think across the state, there's been some challenges, in large part, not because there isn't need, and not because there isn't willingness of the hotel and motel owners with whom we're partnering, but there is some staffing capacity. We at LA Family Housing have just in the last 21 days hired about 18 staff to help support these new hotels and motels. In terms of, so that was the one question, was about, are they occupied? Some of the challenges in occupying them had to do with staff capacity. But at LA Family Housing, I'm proud to say that of the 4 county motels that we're operating in partnership with LASA, Department of Health Services, and other city and county partners, we are fully occupied and fully staffed.
Great. Another Project Room Key question. Are you finding that the people coming into the Project Room Key sites have a lot of medical, psychosocial, and personal care needs? And if yes, what are some successful strategies you've employed to address those needs?
So thank you for that question. The priority population that we reached out to move into Project Room Key, as Quentin was saying, are older adults and those with underlying health conditions. So yes, a lot of people moving in do have underlying health conditions with or without COVID living amongst us. So yes, we do have our most vulnerable, some medically frail, older adults living in many of these sites. We also do have people with psychosocial challenges that we are linking them to appropriate services. So as Quentin walked you around one of our Project Room Key sites, you saw we have the nurses station. So we have nursing staff on site. We have case management staff on site. We have partners through the disaster service workers, county and city employees that have been volunteering, and they're on site, all helping to lift up and support the residents. We have partnerships with food delivery. We're able to provide meals every day. So we're really bringing the resources that our participants need to stay indoors, to stay safer at home, just like all of us are doing.
Thanks,
Katie.
Stephanie. Thank you. Again, on Project Roomkey, can you talk a bit about the plan for after the Safer at Home order has been lifted for these motels, for these participants at these motels? Where will they go?
The exit strategy was something we all began thinking about just as we were moving people in. So Project Roomkey, when it was launched, was a 90-day program. But that's when we didn't know very much about what COVID was going to look like. So one of the strategies is seeing, can we extend any of these stays in the motels and hotels? But really what our primary goal is in all of LA Family Housing's work is to move people into permanent housing. And that's no different for participants in our interim housing, participants still living outdoors, or participants living in our Project Roomkey sites. We have housing navigator staff, housing navigation staff like Quentin at these sites so that they can be working on housing plans with each of the residents living there, making sure that we're getting them document ready if that's one of the barriers, making sure we have employment specialists on site at the hotels, making sure that we're still working on increasing their income so that they can afford to move into permanent housing and be stable and successful in that housing.
Great, thank you, Stephanie. Similarly, along these lines, one of our viewers wanted to know kind of what can the public do? What can our supporters be doing to urge elected officials? How can voters encourage political representatives to support these temporary measures and make them more permanent?
That's a fantastic question. We've had such overwhelming support by the private sector, whether it's business leadership, faith leadership, individuals, corporations, whether people have been supporting us with dollars to help LA Family Housing keep going, or supporting us in your advocacy, lending your voice to our efforts. So letting your elected officials know that you want these residents in Project Roomkey sites, in the RAP sites, to be able to move into permanent housing. The way that happens is if we build more permanent supportive housing. So COVID didn't cut down our need to continue building housing. Daniel took you on a tour of the Arroyo. That's one of 3 sites under construction right now that will be wrapping up in the next year. We need to continue building housing. So just like before COVID, we need you all who are watching us and joining us today to come out and support when there's new development proposed for your neighborhood, to write letters to your elected officials. But another thing that we really need is much of the Project Roomkey support is being funded by FEMA. They're funding about 75% of the operations. We need that federal funding to continue. We are in a disaster with this pandemic. We were in a housing crisis before, and it's just been exacerbated by the pandemic. And so having that federal support is really key to the success.
Thank you, Stephanie. We have one last question that I'm seeing, which is, are you still accepting in-kind donations? So that was actually something I was going to talk about for a second, Stephanie. Yeah, so we have been overwhelmed, literally overwhelmed with the support we've seen from our partners, our donors, our supporters in terms of monetary donations coming in to support our frontline response, in-kind donations. We have neighbors and partners that have brought us masks they've made at home themselves, microwaves for our Project Roomkey sites, clothing that people need, food donations. We are just so grateful for all of the support we've seen. And so we urge you, if you'd like to get involved and you'd like to give back, there are many ways to do this. There's of course always a monetary donation. There are in-kind donations that are so helpful and so supportive. And then you can volunteer your time. We've created several volunteer programs that you can do from a safe distance. And you can also volunteer your voice. As Stephanie mentioned, advocacy, speaking out right now, urging your elected officials to support this work and keep it going is so critically important. And so if you'd like to learn more about different ways to get involved and support LA Family Housing and our work to end homelessness in Los Angeles, you can visit our website. It's lafh.org. And you will see immediately a COVID-19 pop-up window, which will take you to a page that has all of these different opportunities. So we're really just so thankful to all of you for being here today and for supporting the work that we're doing. Stephanie, I'm going to turn it back to you for some final words of thanks or inspiration. Thanks, Stephanie.
I don't know if it's inspiration, but it is definitely deep gratitude. So thank you again for joining us. During this time of physical distancing, I'm truly grateful for how we have all still found a way to come together. We're stronger together. We will thrive during this pandemic by working together. And with your support, we will move more people home together. So thanks so much for joining us. See you all soon.